Good day, everyone, and welcome to the SuperTalk. My name is Gonzalez. I'm superintendent of schools. I'm glad to be here with you all today talking about a very important topic, COVID-19. We have with us Jake Berry, who is the producer of the SuperTalk. Jake, thanks for being here as always. And we have Jonsete Reyna, who's a nurse practitioner in town. Jonsete, thank you so much for taking time from your busy schedule to be here with us today. Before we get started, Jake, if you would, please tell us a little bit about Jonsete.
Yes, she's a family nurse practitioner with Life Touch Health and Wellness Clinic. In the past 14 years, she's been working in the Valley in various fields of nursing, from acute care to home health, and currently she's in the field of family practice. She did her nursing degree in New York City, and she earned her master's at the University of Texas at Arlington.
That's awesome. Congratulations on all the success, and I appreciate you being here once again. I have a series of questions for you. Yes. I know that when COVID hit in March for us as an independent school district, it really transformed the way we went about doing our business. And a big part of that was just so many unknowns. Absolutely. And here we are all these months later, and we're still dealing with so many unknowns. So I wanted to bring in an expert from the community that deals with COVID on a daily basis to ask you some questions. But before I do that, if you would, tell us a little bit about your experience with COVID-19 and what you've learned along the way.
Absolutely. Well, thank you for having me here. I'm really excited. This is something that is very important to me. I think it's great that you guys are educating the community and just really want to get some information out there. Like you said, COVID was something that was just novel to everybody. And I know that from my experience as a medical professional, I really didn't think it was going to come down here, honestly. And then all of a sudden, from one day to the next, it was here, we were shutting down. So yes, like you said, it had changed everything for our kids over the spring, and it still changes. It's such a dynamic virus, and so everything is really changing. One thing I tell everybody is because of the changes, there's really no set true policy and procedures that you can follow, because you gotta keep your knees soft, gotta be ready to pivot, because it's just changing all the time. So the only thing we can do is just educate ourselves. As far as myself, I actually took care of COVID-positive patients. I took care of some of the, people that were on the front line, some doctors, nurses. I started testing patients. We did a lot of testing, and so I just really got myself really knowledgeable about the labs and testing and the different procedures, and just trying to understand it so I could better explain and understand it for my patients as well.
Well, that's great, because the first question we have is, in this environment that we're in, it's all about contact tracing, who's positive, trying to figure out who needs to be quarantined. But I guess the root of this whole plan that we have in our district, and really the people that have across the world around COVID, is the test.
Yes.
So what are the different kinds of tests that are out there? What are the differences between these tests?
Yes. So that is a great question, and that's something that is very important for people to understand. I mean, it's something that people need to know before they go spend money on tests that are not necessarily, important. So what happens is that there's 3 types of tests, and people identify them well. Is it the nasal test? Is it the one that they swab you in the nose? Or is it the rapid? Well, those are things that can't be labeling the test. You've got to know what your test is, okay? So there's the PCR, there's the antigen, and then there's the antibody test. So the 3 different tests, you can do swabs through PCR, you can do swabs through antigen. Antigen is a rapid, and PCR does have a rapid now. So those cannot be the identifying factors that people use nowadays. So you have to educate yourself. So as far as the PCR test, I really like to explain to patients and people in the community that don't have a medical history or background. So what I like to tell them is that the PCR test, it basically is a type of test that tests for the RNA. So the RNA is like their genetic buildup or makeup for the virus. And the thing about it is that, like, we have DNA. And so, so this is the same thing for the virus. And so what it does is it actually takes a sample of the RNA. And so it's very accurate, because if you have RNA, then the virus is there, right? So then the other test is the antigen test. This test actually picks up proteins. So you've seen the ball of virus, and then you see these little, how can I say, they're just like little tentacles, okay? These tentacles that are out there are the protein. And so that is actually what this test does. It tests for the protein. So a lot of the times when it's positive, it is reliable. But when it's negative, it is unreliable. That's like leaving a piece of hair at the scene. And so sometimes you may leave a piece of hair at the crime scene, or sometimes you're really good and you don't leave anything. So the problem with that is that there's a lot of false negatives when it comes to the antigen test. So the possibility of somebody really being sick and being in the community and infecting other people is really high. So you don't really want to go with that test. Then you have the antibody test. And a lot of the times that's done by blood. And I've heard people say, well, we got it, a finger stick. That's not the way to get it. You have to get a venal draw. On top of that, that is only to tell if you've been sick. A recent illness, but not too recent, or you've had it and you've recovered. So it really doesn't tell you much information. You want to know if you're sick and you are contagious is what you want to get to the bottom of.
And what about, did you mention PCR? You did?
Yes.
Okay.
Yeah, the PCR is the molecular one.
And that's the one that's the most accurate,
That's
right?
the most accurate because that's the RNA. That's the one that says, hey, we caught the actual live virus, what it's built of.
So for all the community members out there, if they're wondering what the most accurate test is, it would be the PCR test.
Correct.
Because that's the one that looks at the RNA. That's the one that looks like the DNA,
Correct.
the makeup.
Correct.
So it's very accurate.
Yes. So when you have a crime scene and you have DNA, they're guilty, right? There's just
Right.
no ands ifs about it, So it's the same thing with the PCR test. It grabs the RNA, and so it tells you if that's there. So you can't have the RNA if the virus isn't there. Right. So it is very accurate.
And that's why I wanted to have this super talk with you, because there's so many community members out there that are in the midst of setting up for a test, that need to test, that may have a child of themselves that aren't feeling well, and they're wanting to know, what test do I take? So now for all of you out there, it's the PCR test that's the most accurate. So if you're going to test, then that's the one that's going to give you the best result. And how much time does it take to get your results back on the PCR?
Okay, so the PCR, they have where they send them off. They take either a nose swab or an oral swab, and they'll send it off for a few days, and then you'll get your results back within 3 days. There is a new test that is out that has been approved. It's called the Abbott ID Now, and that is a fast test. So I don't want people to confuse it with a rapid, but it is, you can get results within 15 minutes.
Okay, and you mentioned rapid. I hear a lot about that. We're going to take a rapid. We got a rapid test, and is a PCR test a rapid test?
Well, now they do have the rapid PCR test, which is the Abbott ID Now. So it's hard. I'd like to educate people to say, to not identify the test based on rapid or nasal. You really need to know what the test is. What are you testing for? Are you doing a PCR molecular? Are you testing me for the antigens, or are you testing me for the antibody? So I want people to really kind of take that rapid out of their mind.
Okay, so take the rapid out of your mind. The PCR is the test to take.
Yes.
And when you go to take it, or when you go to take a test, those are questions that you have to ask. So that's great for the community to know.
Yes.
And that was the main aims and objectives of this talk, was just to make sure that we clear the air on that one. So all you out there watching, thank you for being here with us on the Super Talk. But I hope that if you plan to take a test, that it's the PCR. And if you've taken a test that wasn't a PCR, that you know the limits if it was an antigen test or an antibody test.
Correct. Yes.
And another question that gets asked is the cost. What are the different costs of the tests? Are there any free tests?
Yes.
Are there any?
So a lot of different counties and cities and things, they do have these testing sites, and they do make these tests available. It just depends. A lot of the times they are going to be the PCR test. But remember, you have to go to a reputable place, because you want to make sure that they are swabbing and you're not swabbing yourself, number one. Number two, the costs. Those are covered at times, but a lot of the times the insurance will cover a PCR test, but you do need a physician or a nurse practitioner or PA's orders to get that test. You need to qualify. Usually the antigen and the antibody test, you do not need a prescription to get that, or an order to get that.
Awesome. Great information for us. Great information. And another question that we get asked a lot at the district level is, when should I test?
Yes, absolutely. So one of the things is if you've been exposed, obviously, you want to get tested. If someone has been confirmed in your home or around you, you do want to get tested, number one. Number two, if all of a sudden you've developed some signs and symptoms, loss of taste, loss of smell, you just don't feel well, fever, that won't go away. Just one of the symptoms is GI, it's diarrhea, So any of these symptoms, you want to call your provider and get advice as far as when to test. But don't wait, because if you wait, when you have these symptoms, then the chances of infecting somebody will be great. And we want to contain everything.
Very good. That's great information to know. And also there's many people that test and then they want to know, what do I do between the point that I take my test and I get my results?
Okay, that is a great question, because this is where we need to get everybody on board and on the same page. When you test, it is very important that you alert everybody around and you stay isolated for a few days until you receive the results, okay? And then even after that, the test results are usually just as good as that day, as long as, you're not out and about in the community. But yes, once you test, you have to stay home until you get your results.
That's good to know, because we want to make sure that we don't spread the virus. And that's the big thing. It's going to take a team effort. That's one of the things that we're doing right now as a district, is we have a plan to phase kids back in.
Yes.
And right now we have a very small group. We have about 60 kids that are in with us right now. We have about 10 teachers, maybe 38 instructional aides. So it's a very small group that we're dealing with. But we brought in our athletes. We have varsity athletes that are participating right now in practice and doing things like that. And the coaches are doing a great job of making sure that what we call the 3 W's, right? The wear your mask, the watch your distance, the wash your hands.
I love that. Yes.
That's what we're trying to push. But I know that as we get closer to the November 16th date, that's when parents in McAllen ISD, November 16th, they're going to have a choice. Parents are going to be able to bring their kids to school 100% of the time. They're going to be able to keep them home remotely 100% of the time. Yes. Or they're going to have an option for a combination where they come 2 days out of the week. But they still want to know, what can I do to protect my child?
Absolutely. So I want to commend you guys as a district, because you guys are really taking so many initiatives. I know I've spoken to a few people here, and you guys have really taken some initiatives to protect your kids. But one of the big things that parents can do is, there's several things, really. Number one, it's about masks, and our kids, they watch us. So if masks are important to us, they're going to become important to them. So we really want to set a good example at home. And like you said, the 3 W's. If we can get these kids at home to practice the same thing, then we can really try to contain this. And if they know this is routine at home, then they'll follow through and they'll do it at school. Number one. So yes, mask is very important. The other thing that's extremely important too is transparency. Okay, transparency is a big thing for me in opening schools and keeping schools open, really. I've got children that are in school, and I really want to make a safe environment for them, but I also want to make a safe environment for anybody that they come in contact with. So what I do is I really want parents to understand that it's important to talk to the schools, talk to your school nurses, let them know, little Johnny has some allergies, he's not feeling good. Let them know. Or call the nurse and say, you know what, my husband just tested because somebody he works with was positive. So, you know what, we're going to stay home. So, I'm going to keep Johnny and Janie home today, So this is the thing that we have to do. We have to let everybody know that there may be a possibility that we are positive. And that way, not only do we protect ourselves, but we protect others. And we would hope that everybody would do the same, for our kids.
Yeah, that's a good point. And that's one thing that I hadn't really thought of until you just mentioned it right now, because as a district, we have a district task force.
Yes.
So we're communicating with campuses, and then we have campus task force. And what they're doing is if anybody's positive or anybody's in a situation where they're showing signs, and we get all the testing going and things of that sort. But we put out a letter to the community and we let parents know that we had a positive on the campus so that we're transparent.
Right.
We also put out a letter, if you had a higher level of exposure based on our contact tracing, then we'll let you know that you were highly exposed and you should get tested and you're going to need to quarantine.
Right.
But the point that you're making is there may be a family that went to go visit relatives in Corpus Christi or somewhere else, and somebody over there was positive.
Absolutely.
Now, they've come back. We have no knowledge of that. What you're saying is it needs to be two-way communication. You need to let us know also so we can protect one another.
Absolutely. Absolutely. That's the only way we will be able to keep our school, not only open them, but keep our schools open, keep our teams out there playing, is being extremely transparent. Parents, it's very important. The other thing that I wanted to talk about as far as, children, how to protect your child is, we're in allergy season. And in allergy season right now, you got all these different symptoms and things, and it could be one thing or another. One thing you can do is just get with your provider and make sure that your children's allergy medications are up to date. You're not missing any refills. Their immunizations are up to date, flu vaccines. All these things are little things besides being transparent that can keep your kids safe and keep them in school.
That was another question I was asked the other day, and I thought it was interesting. They said, well, what about flu season? How's that going to impact COVID? And I said, well, it's very real, but I think that wearing masks is going to help in that arena. What's your opinion on that?
Oh, absolutely, absolutely. The masks are definitely going to create a barrier. It's going to definitely protect your child and other children too. So yes, they need to. But you can have added protection by getting your flu vaccine, getting the children's flu vaccine, trying to avoid these things.
So if you hadn't got your flu vaccine, to all the parents, all the community members, please get your children vaccinated with the flu vaccine. Also parents, if you hadn't taken one yet, go ahead and do that too. We all need to do our part and work as a team. And that's the big reason for the Super Talk today, is to make sure that we had this very important conversation, to make sure that everybody understands that this is two-way communication. This is a team effort to get COVID-19 numbers down, and at some point get all of our kids back into the school so that we can continue educating them. But I will say to all the teachers out there, you're doing a tremendous job here in McAllen ISD with remote learning, with teaching and everything that you're doing with the device. And students, I know that you're working hard. So we're very proud right now of how hard our children are working.
Yes.
But we also know that at some point, and that date for us is November 16th, parents are going to have to make a choice.
Yes.
So we want them to know that we're prepared, we're ready, we have systems and processes in place. And my last question, this is just one for the community right now, because you mentioned allergies.
Right.
You mentioned other types of illnesses, but what are the signs and symptoms that should just really alert somebody for, hey, I need to go get tested?
Right. Well, obviously, the fever is going to be the big key, okay? But sometimes kids have such a high immune system that sometimes they may mask those symptoms. So when you see your child, they're not feeling well, they're just not being themselves, fever, cough, runny nose, weakness, GI issues, some vomiting, diarrhea lately, sometimes a rash. So these are all issues: loss of smell, loss of taste. All these things can be signs and symptoms, but they are also signs and symptoms of other things. So we just really need to be on high alert right now as we go into this new flu season and the changes with the weather and the winter coming in. So that's going to be a big deal.
Well, as we close the Super Talk today, Jonsete, I do want to thank you. I know that you're very busy. I want to thank you on behalf of the school district and our board for taking time from your busy schedule to be here with us. And to all the parents, I hope that the Super Talk today was beneficial. I hope that you'll consider the PCR test. That's the one that's most accurate. And that if you haven't taken your flu shot yet, or your child hasn't, that you do that as soon as possible, and that you understand the importance of two-way communication, and reach out to your campuses or to the district if there's anything that we need to know. And then we'll do the same with getting letters out to you all if there's something that you all need to know. So, Jonsete, thank you so much for being here today.
Thank you for having me.
You're very welcome.